Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Bionic eyes have been researched for many decades. In fact, in the 1950s, there was a patent by a fellow by the name of Edward Tassiker in Australia that was the first one to put forward a device that was implantable that could conceivably restore vision. Since then, researchers have been working very hard to get a viable device, one that is actually beneficial to human beings. Now, our visual system is so complex that a human-made intervention that tries to replace it is a very tall order. However, we've been making some excellent progress over the years. In fact, you can now purchase a bionic eye in certain parts of the world and get some rudimentary vision happening with certain types of blindness being treatable. With our approach, we are putting our electrode array in a particular location of the eye called the suprachoroidal space, which is behind the retina and behind a layer of blood vessels. And from that particular spot, we are able to comfortably put an electrode array that can last for decades in that position, and we can deliver our electrical impulses that activate nerves that restore vision in a way that others have so far been unable to do. Haven't been able to restore vision for a long period of time and deliver it in a safe and efficacious way.
Question 26. Now read the question.
Really, ARCS is about enabling people to understand what's happening in our sector, the changes, and really the industry life experiences that will enable people to do their jobs in this sector. Our sector is highly regulated, there's a lot of guidance around what we do, it's global. So being able to educate and share information is incredibly important. And that's why it's important to be a member of ARCS. You become a member of a community where everybody helps each other to share experience. If they've had some information around regulations, they share it with everybody. That's what we're here for. We're to provide that mechanism to enable people to understand how to do their job better. So we have it's a member-based organisation. We're a not-for-profit. We really are our members. If you're not an ARCS professional, then you're not in the industry. So come along and talk to us about membership. We'd love to see you. We'd love you to be part of who we are. We are taking a big position in relation to training, but also advocacy in the sector, talking to governments and other companies to see how we can do things better.
Question 27. Now read the question.
This is B Hall. Hey there, Lucille. And this is Marvin's room. He's such a sweet man, but the poor thing just stays sick. Speaking of, I don't know if you noticed, but we try to divvy up residents by the amount of care they need.
Well, how so?
Well, we try to spread residents that need continuous care and bedfast residents equally among all the halls, and that way all of our staff members should have fairly equal responsibility, which is especially relevant when there's an emergency.
So if I'm working a hall and we have to evacuate, I'm responsible for all of these residents?
Well, hopefully it doesn't come to that, but occasionally we do need to move residents from their rooms to a safer location in the facility when we shelter in place. Don't worry, if you need help, we'll make sure you have it. I always tell all my staff members to keep an extra change of clothes, toothbrush, all that in their lockers at all times. You never know when something could happen and keep you here a whole lot longer than you expected.
What about food? I mean, how much extra supply do you have?
Well, we keep about a week's worth of food, medications, water on hand at all times, and that's enough for residents and staff.
Question 28. Now read the question.
Can you describe the pain to me?
Comes and goes.
Okay.
It's sometimes sharp pains, sometimes goes over my stomach from one side to the other, or lower back, or I can't sit comfortable for a while. I got to move around or try to stretch. It's difficult standing up sometimes and just trying to stretch out, so it's hard.
So moving around and shifting your weight, stretching out sometimes helps.
Helps a little bit.
Okay.
It puts me at ease a little bit.
All right. Any other symptoms that you're having with it? Any nausea or vomiting?
Some nausea, no vomiting,
Okay.
but I don't feel hungry. I don't feel like eating anything.
Okay.
Try to drink to keep my mouth wet. It gets dry.
Your mouth gets dry. All
So,
right.
just more liquids than anything.
All right. Any, besides the abdominal pain, any pain in your chest?
No, not really.
Okay.
Sometimes when I call for a sneeze, I feel it, but it's not really bothering me in general.
Okay, good. How, I know you're having some difficulty with your bladder. Any trouble when you pee?
Sometimes it you go, you stop, you go, you stop. Sometimes it's irritating, it burns, or
Okay.
I don't know what else how to describe it, but.
Question 29. Now read the question.
All right, so we'll go ahead and begin our discharge case conference. This is Kristen over here, and she's a nursing student with me this week. The first patient we're going to discuss is Mr. Potter in room 262. He's going to be going home later today. He was a 78-year-old male who was planning on undergoing TMJ surgery a month ago, but during his pre-op workup, he was found to have coronary artery disease. He underwent stenting on one vessel, and then he was discharged home. He then presented here a week ago with stent restenosis and underwent coronary artery bypass. We are currently at post-op day 7, and I think, Dr. Mayo, that you've signed off on him and cleared him for his discharge. Is that right?
Yep.
Okay then, I've arranged for him to be discharged to home with his wife, and working on the paperwork to get him started on cardiac rehab. So, Landon, could you give us an update, please, on his status?
Patient is stable, vitals and labs look alright. He's recovering well from a cardiac standpoint, but he keeps complaining a lot about taking his meds. Patient and his wife are pretty much ready to get out of here, but no one has done the discharge counseling yet. He's freaking out about his recovery, and he keeps talking about gardening. TMJ is still bothering him. Someone needs to go talk to him.
Question 30. Now read the question.
As a nurse or a former clinical trial nurse coordinator, I've worked at the front line and seen the difference that access to a clinical trial can make in people's lives. And I've also seen clinical trials fail to meet their recruitment targets, resulting in missed opportunities for patients. So I'm very passionate about ensuring that people have a pathway to access the information to these potentially life-changing opportunities. And so my work with CTR is really dedicated to access to clinical trial information, and my work with the Whitecoats Foundation is really all about creating awareness about clinical trials and clinical trial participation and how to gain access to these opportunities. In 2016, INC Research, who are now Syneos Health, and CIS Group in America ran a crowd-solving competition called the Inspiring Hope Ideathon. They were seeking ideas from people around the world on how to raise awareness about clinical trials and clinical trial participation. I submitted an entry at the time, and my idea was selected as one of 14 finalists from around the globe. I flew to Boston to present that idea, and although it didn't win at the time, the organisers were so inspired by my concept that they decided to sponsor the development of it anyway, and that was launched earlier this year. So that concept was actually a video that thanks volunteers for their role in the drug development process and the role they play in helping bring new medicines to market.
That is the end of Part B. Now look at Part C.